A lot of people have nutritional deficiencies. So we test people, get them on extra amounts of B vitamins, magnesium, calcium, other natural anti-inflammatories. One especially for exercise-induced or exertional asthma, which has been very well studied, and is lycopene. Lycopene, which you find in foods like tomatoes, watermelon, it's a very potent antioxidant. And that has been shown in studies to reduce your risk of exercise-induced asthma. And the beauty of that is it's non-toxic.
Right.
And there's no side effects to it. So
Now,
we get people on nutrients like that.
A couple of those studies, you talked about lycopene, which is was really a study taking 130 milligrams daily shown to be helpful for those affected by exercise-induced asthma.
Absolutely. Now remember the dose, 130 milligrams. When you look at most lycopene products, they may have 5 milligrams, 10 milligrams, up to 30 milligrams. So you have to take a fair dose of it, but it's okay because lycopene is non-toxic. So if you have asthma, you got to take that higher dose to get a good effect.
Now for children, how does that go? Same dose, a little less?
Yeah, children, usually we use about half the dose, 65 milligrams. Again, it's not a concern because it's non-toxic, but normally around 65 milligrams will work quite well.
Okay, now for the magnesium study shown to reduce asthma, 250 to 400 milligrams daily, another well-studied nutritional supplement.
Well, magnesium's a must. Even in a recent study, they have shown that if your magnesium levels are lower, you are more apt to have asthma problems. And remember, magnesium is a relaxant mineral, so it relaxes the bronchial tubes, which people with asthma are prone to, tightening. Also, in a clinical setting, we'll even use things like intravenous magnesium to get high doses in to relax the bronchial tubes and to release that constriction they're getting in their lungs.
Let's read the study about pycnogenol. This is an interesting supplement many people haven't heard of, actually. No, go ahead.
I'd say also known as pine bark extract. So just people are looking for
good point.
Pine bark extract, also known as pycnogenol, but yes.
No, good point. Randomized, placebo-controlled, double-blind study. People love that.
It's all good study.
Good study, right, apparently. 60 subjects, age 6 to 18. So children,
Younger,
to adult, that's great. Conducted over 3 months. So this wasn't a 1 week, this was 3 months, which is really good. I love that. Researchers found that those who took the supplement had significantly improved function in lung function and asthma symptoms compared to placebo. This study was published in the Journal of Asthma.
So it's in a mainstream journal. I had a patient recently, actually a friend of one of our kids on the same hockey team, who's had asthma for a number of years. And besides making some dietary changes, we put him on this pine bark extract. And I'll tell you, the mother reported back even after a month, he did not need his inhalers anymore. Now, obviously, we're monitoring him medically, but some of these simple, non-toxic nutrients combined with good diet can be quite phenomenal.